Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 Media Briefing Conference Call. At this time, all participants' lines are in a listen-only mode. After the speaker's presentation, there will be a question-and-answer session. To ask a question during the session, you'll need to press star 1 on your telephone. Please be advised that today's conference is being recorded. If you require any further assistance, please press star 0. I would now like to hand the conference over to your speaker today, Speaker Mike Schumer. Thank you. Please go ahead, sir.
Thank you for joining us for the COVID-19 media call for October 16th. We'll start today's call with comments from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Kris Ehresmann. Following that, we will hear from Hennepin Healthcare CEO Jennifer DeCubellis. Then we will open it up for questions from reporters on the line, and I should mention that we also have MDH Assistant Commissioner Marie Dotseth on the call to help with questions. With that, we'll start with Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Well, around the world this morning, we're above 38.9 million cases and over 1 million deaths. And in the United States, we are over 7.9 million cases and, sadly, 217,000 deaths. Here in Minnesota, we have a new total of 1,119,396 cumulative cases, up 2,297 lab-confirmed cases from yesterday. So of these 2,297 cases, I just want to keep this in quick context. We'll come back to this in a few minutes, but this very large number, really an eye-popping number to be sure, is on our highest volume of tests in a single day by far, 44,398 tests processed yesterday. Of the positives, 2,287 of the cases were from PCR tests, and 10 of the cases were from antigen tests. So PCR positive was by far the majority. Only 10 of the cases were from antigen positives. Sadly, we have 13 additional Minnesotans having died yesterday, bringing us to a total of 2,212. These 13 Minnesotans were from across 10 counties, family members, friends, and colleagues ranging in age from their 50s to over 100 years old. 11 of the deaths were among the PCR positive group and 2 were among antigen positive cases. 7 of the deaths occurred among residents of long-term care facilities. As I mentioned, this number of over 2,300 cases in a single day is really a very, very sobering number. We've never reported over 2,000 cases in a single day since the beginning of this pandemic. 2,300 new cases in a single day. That's, again, family, friends, neighbors, colleagues, loved ones who've been affected by this disease. You might be wondering whether the addition of the antigen test volume that we made this week is driving these increases, and it is clearly not the reason for this huge jump in cases. As I have already mentioned, of today's just under 2,300 cases, only 10 were from antigen tests. I'm very saddened, and I'm frankly deeply worried about today's numbers, but I'm sadly not surprised. For a number of weeks, we've continued to see our case numbers climb. In 12 of the past 16 days, we've seen our daily new case counts over 1,000. Our previous record high was just last Friday when we added over 1,500 cases, and we were kind of stunned by that number. Today's new record high is 50% higher, a significant jump in just 1 week, and acknowledging that we've also seen a very significant jump in testing volume. We'll come back to that in a moment. There's been a lot of media attention on the case growth in Wisconsin and the Dakotas and Iowa. Our neighbors have seen quicker and sooner case growth than we have seen, and certainly some folks have taken comfort in the fact that our numbers were not growing as quickly as our neighbor states. But we just can't assume that's going to last. The rate of Minnesota's increase, frankly, is starting to look more similar in recent days. From the middle of September to last week, Minnesota cases per 100,000 people increased by just under 16%, 15.9%. In comparison, over that same time period, case rates in our neighboring states increased by 26% in North Dakota, 47% in South Dakota, and just under 20% in Wisconsin, 19.9%. As predicted, not too far behind this rise in cases that we've been seeing, we've also seen a rise in new hospitalizations. In total, throughout the pandemic, we've had 8,718 people hospitalized. 2,375 people have spent time in intensive care units. Today, there are 461 people in the hospital, 137 of them in intensive care. Now, the new daily admissions to the hospital and the ICU that you can find on our MDH situation update page clearly are trending upward. This tells us that more people are being more severely affected by COVID-19, and as more people get sick, that's unfortunately something we expect to see. And again, this week, we're saddened to see rises in the number of deaths we're reporting each day, with more double-digit days, an additional 13 deaths today, as I mentioned. Back to the testing volume increase. We're certainly very, very pleased to see very strong testing over these recent weeks. Our test volume is up 65% since early September, as we've reported previously. Today's volume of just under 44,400 eclipses the last single high day, which was October 1st. The prior high was 32,077 on October 1st. So that's a big jump in testing. However, the 7-day average testing positivity rate is also heading up. It is now 5.3%, up from 5% last week. And we, as you know, have considered a 5% test positivity rate to be sort of the caution level indicating widespread disease growth. And we've been above that level for 18 days now. Now, let me be clear, more testing is good. It's necessary because it gives us a clearer picture of the true number of COVID-19 cases. And critically, it gives individuals the chance to know if they are positive, not only so they can get care if they need it, but so that they can take the necessary steps to protect their loved ones and their communities. It's why expanding access to testing is such a big priority for us. But quite honestly, unless people act on the knowledge that they are positive or could be, just having the numbers doesn't do us much good. I also want to stress that this dramatic jump in cases today is not because of a backlog of cases being added. That has been true in terms of test volume in cases a couple of other times, but that is not the case with today's numbers. And this is not because of one specific particular event or large gathering, and it's not because of any one known large outbreak. Instead, it is the result of just steady, inexorable spread in communities across the state between people who don't know they have contracted the virus. It's that community spread, fueled in large part by asymptomatic transmission, that we've talked so much about. We've been dealing with this now for over 7 months, and the exhaustion and the weight of this situation is real, and it has set in. People want to get back to normal. Believe me, all of us in public health totally get that, and we feel it too. It can sure be easy to let down our guard in the face of this fatigue and in our eagerness to get back to some of the things we most cherish. It can be easy to think it's okay not to wear a mask just this one time if I'm just seeing my friends or my family. It's definitely easier to try to forget about this and to just have a moment of normalcy. But I have to say, some of the things that we maybe have come to think it's okay to do in these recent months, with this level of community spread, this level of virus all across our state, some of the things that we maybe thought was okay to do a month or so ago is much, much riskier today, just given this level of viral spread around our state. We have to stay vigilant. We have to think about our friends, our neighbors, our family members who might be most vulnerable to this virus. It spreads when you don't feel it. It spreads when you don't know it. And the results can be really scary. Now, we know we are going to make it through this. There is going to be a time when we no longer have to worry about not being protected against COVID-19. I can't tell you when that will be. I wish I could. But something I can tell you is that if we do the right things now, if we keep doing the right things, if we redouble our efforts to do the right things, we can make the time until that day comes much less difficult. We are, and I know I've said this before, but it continues to be true, even more true today at this sort of accelerating growth pace that we now seem to be at. We're at a pivotal point. We really need to take action now, each of us. You might think, I'm just one person. What difference does it make what I do? But if everyone does their part, we really can shift the course in a more positive direction for Minnesota. Each of us has a big impact, whether we do or don't follow the basic prevention steps of staying home if we're sick, staying 6 feet away from others, wearing a mask, washing our hands often. I know it sounds simple. I know this is repetitive, but if we all do these things consistently, it can make such a big impact. And these actions don't just protect you or your immediate family, they protect others. The way that the transmission happens, the multiple kind of generations of transmission, the chain of transmission, we don't even see where all that leads. But a case can, in a second, third, fourth generation of transmission, end up affecting so many others, including the healthcare workers that we are depending on to be there to provide the care to the folks who get really sick from COVID-19. And to share more on this point, I'm going to invite Kris Ehresmann to share a few thoughts, and then we'll have our guest for today, Hennepin Healthcare CEO Jennifer DeCubellis, share her perspective. So with that, Kris, I'll turn it to you.
Thank you, Commissioner. I'd like to share some data on healthcare worker transmission and exposures, which can help all of us see the impact that community spread is having on our healthcare workers and our healthcare system. Our team tracks healthcare workers who would have had a high-risk exposure, and what we mean by that is without wearing full personal protective equipment. And the number of high-risk exposures has increased monthly since June. In May, 18% of our high-risk healthcare worker exposures came from patients in acute care and outpatient settings, and 24% from social or household settings. So, in other words, a smaller proportion of our exposures came from the patient care setting, 24% from the social or household. But in September, we saw a dramatic change. That dropped to 8% of healthcare workers' high-risk exposures came from patients in acute care outpatient settings, and we saw an increase to 62% from social or household exposures. In the long-term care setting, we have also seen a shift from May, when the majority of new cases were occurring in residents, to now when the majority of new cases are occurring in staff. We are increasingly seeing the impact of community spread and social exposures on our healthcare workers. If we look at the likelihood of testing positive for COVID based on exposure type, healthcare workers with an acute care exposure tested positive 1.8% of the time. In long-term care, if that was their exposure, 7.8% of the time. If they were exposed to a coworker, 4% of the time. And if it was a social or household contact, 12% of the time. And note that inside the healthcare setting, high-risk exposures to coworkers are equally as common as exposures to infected patients. So healthcare workers who experienced a household or social exposure were more likely to test positive within 14 days. The challenge in healthcare is not only those healthcare workers who test positive and must be isolated, but also those who are exposed and must quarantine. The absence of staff for both of these reasons puts a strain on the healthcare system overall. An example of how this can play out in a workplace: we are aware of an acute care unit in which a number of staff attended a wedding. There was COVID transmission at the wedding, so a number of the staff in attendance tested positive. They needed to be out of work to isolate, but in the meantime, they had unknowingly exposed their colleagues who also had to be out of work due to exposure to a case. The end result was a lack of staffing for the unit. The high level of community transmission is impacting all of our sectors, including healthcare. Please consider this as you make decisions about masking, social distancing, and socializing in large groups. You may just be reducing the likelihood that someone is available to care for you when you get sick. And with that, I'd like to turn it over to Jennifer DeCubellis.
Thank you, Kris, and thank you, Commissioner Malcolm. I appreciate the chance to be here today. I can't say enough how fortunate we are in Minnesota to have health systems in place that work to collaborate across large and small healthcare systems, across the rural and metro systems, and across the state and at the local level. We haven't seen that nationally, but in Minnesota we truly have health systems working together. We're not just working across health systems, we're working inclusively with public health. We're working with long-term care providers, and we're working with the community at large to try to do exactly what you heard the state staff talking about, which is prevent that community spread and keep everybody healthy. The state's leadership and local responses are making a difference every single day to ensure that the care is available here at the hospital, the community clinics, and even in your homes for home health every single day. That's our top priority. Health systems across the state are partnering also with the Minnesota Hospital Association to work together to align our resources, to lean on each other for new knowledge, new skill sets, align our efforts to truly make sure that health care is here for Minnesotans at such a critical time as this pandemic. As was mentioned earlier, we're now 7 months into this pandemic. We've learned a lot. We've gotten better at managing the disease, but we haven't conquered it. We've gotten better at testing, at treating, and at protecting each other, but we have a long ways to go, and we share the state's concern right now for the increases we're seeing, both in the hospital as well as in the community, and in particular to the impact of healthcare staffing. We've gotten our medical services back up and running in the community, in our ambulatory and our clinics, to help keep Minnesotans well, but we need everybody to do their part. We're better prepared to manage both patients with COVID as well as patients with other healthcare needs, including emergencies as they exist. And we're just coming out of trauma season, which has put an additional pressure on hospital systems. Here at Hennepin Healthcare is Minnesota's essential hospital and level 1 trauma center serving all of Minnesota. We're committed to being here to keep people well through wellness checks, health screenings, flu vaccines, the list goes on. We're here to intervene early when you become ill through our clinical care, through home health, through telemedicine. And we're here to respond when you need us most, whether it's trauma or a life-threatening illness or hospitalization, as you've heard many of the numbers coming in. Because we know we need to be here for Minnesota end-to-end for healthcare needs, we watch our bed capacity closely. And bed capacity, the number of beds, the number of rooms, has not been our biggest concern. Our biggest concern has been that COVID-19 is a preventable illness, and we're not doing well enough in Minnesota to protect each other, to protect workers, and to protect the critical healthcare resources so they're available for people when they need them most. We're seeing 2 trends that I'd like to highlight that we need the general public's and communities' help with. We're seeing high levels of hospitalizations that are occurring both because of COVID, and you heard the increasing numbers, but also because of delays in medical care that could have been prevented. We're also seeing increases in the community spread, as noted by Kris earlier. And critical healthcare resources are being impacted, not just in hospitalizations, but in exposure in the community of our own workforce that takes those critical beds offline when we can't safely staff care. So we have 2 asks today. One is, don't delay necessary medical care. Take care of yourselves now so that those critical hospital beds are utilized only when we need them most. And help us help you. Washing your hands, wearing masks, being mindful of social distancing, all of those medical reasons and ways that we can prevent COVID spread are critical so that we can keep healthcare workers in place and we can keep all of our economy moving. I'd like to speak a little bit first about the first ask, which is taking care of your health. We need everyone in Minnesota to remain vigilant on taking care of your health needs. Don't delay care. It may result in higher needs. It may result in hospitalization. And if we can intervene as health systems earlier, our systems are safe to come into and we encourage you to get to your primary care, get the preventative care you need, get your flu vaccines, contact your clinics and your physicians if you have concerns. Taking care of yourself now means we save those critical resources for the increases we're seeing across the state. And to the second ask about doing your part in community to stop the spread of COVID. Our job is to take care of you when you need us most, and we need you right now. Masks are not political. They're essential. In the past several weeks, we've seen staff exposures from community more than double. That is taking critical healthcare heroes out of work. As healthcare providers, we can't save lives and care for those who are sick if our own workforce is being exposed in the community. And I can't say enough how much our healthcare workers, they are your neighbors. Their children are in your schools. Their family members work alongside you. Community spread is not just a community problem, it's a healthcare problem. When our workers have exposure or their family members do, just like everybody in the community, they need to quarantine. That takes them out of providing that critical healthcare service. We need them at work right now more than ever. Community spread, as you heard from Kris earlier, is at an all-time high. Our healthcare workers are essential to care for you, your loved ones, your own neighbors, and not just when they need COVID care, but when they need care because of a car accident, because of the flu, because of a cardiac issue. I can't emphasize enough that bed capacity is not our challenge in Minnesota. It's keeping our hospitals and healthcare systems staffed so we're available no matter what your healthcare need is. So I'm here today just to ask for additional help. As healthcare systems, we can and must stop the spread of COVID, and every bit helps. And while our teams are working long hours to be there when you need healthcare most, it's critical that every Minnesota helps us to help you and uses those masks, washes their hands, uses social distancing, because our staff are a part of the community, our community. Our job is to keep our doors open, and we are working really hard to make sure that stays an available resource. And we're asking each of you to do your part. Thank you, and with that, I'll turn back to Mike.
Thank you, Jennifer. Operator, we are ready to take questions.
Ladies and gentlemen, as a reminder, to ask a question, you'll need to press star 1 on your telephone. Again, press star 1 on your telephone. And to withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Matt Sepik with Minnesota Public Radio News. Your line is open.
Given these numbers today and the continued trends, do you plan to recommend to Governor Walz that he dial back gatherings in public spaces, including restaurants?
Mark, this is Commissioner Malcolm. I think as we've talked before, there are a number of metrics kind of underneath the ones that we've been sharing with you. We continue to monitor all of these trends. We continue to emphasize first and foremost the fact that if, as we've been saying repeatedly on this call and other times, if folks follow the guidance that is in place, we far prefer to just have people follow the guidance that's already in place, paying attention to the gathering limits that have been set, keeping social distance. We know those things can work. What I can tell you is just that this is a ongoing conversation within the administration and across multiple different perspectives of trying very, very hard to protect our economy, trying to keep people working, trying to keep these sectors of the economy open, trying to do everything we can to support our schools to be able to execute their learning plans. But it's just so critical that people take this seriously and do the things that we all have the power to do, as Jennifer just said, and we just need to keep reinforcing the frustration around all of this is these are preventable illnesses. And we all have the ability to make a big difference here.
And just to follow up on that, I think this may be more of a question for Kris. Can you give us a little more context on the testing numbers? It was quite a few, 44,500 tests. nearly 2,300 positive cases reported today. Are those from any one particular location? Are they associated with anything in particular, or are they pretty much spread out across Minnesota?
Those are spread out across Minnesota. As you know, the state has increased its no barriers testing efforts, so certainly those sites are contributing. But no, there's not any one thing, as the commissioner said. I mean, what we're seeing, unfortunately, is that we are seeing COVID at high numbers across the state in multiple locations, and with the ability to test more, we are finding more cases. So there's nothing that, nothing special that we can say, oh, well, it's the fault of this event or this particular testing or anything like that. This is just, unfortunately, widespread transmission of COVID in Minnesota, and we've talked about it coming. We've talked about that ripple effect of those cases from the summer and how it would begin to build and our numbers would increase. And today's really just another day of another unfortunate record in the new number of cases.
Okay, thanks to you both.
Another question from the line of Glenn Howard with Star Tribune. Your line is open.
Hi, thank you. You talked a lot about healthcare workers today. Do you have any data on how many healthcare workers are currently positive and how many are in quarantine as a result of exposures?
Well, first of all, let me just explain that when our team, there are so many healthcare workers that our team only has the capacity to be following closely those healthcare workers who've had what we call high-risk exposure. So that would be, without personal protective equipment. And so I can tell you that if we look at, people who are, I'm just going to pull up the data, if we look at the number of healthcare workers who have had these exposures, we have followed almost 10,000 healthcare workers over in this setting over the course of the pandemic. So, we followed a huge number of healthcare workers to provide you with that data that I did about what proportion were household and what proportion were work exposure, that type of thing.
Okay. Well, Jennifer DeCubellis, can you tell us if you've had to pull beds offline as a result of staffing shortages in the recent weeks?
Glenn, thank you for the question. Absolutely. I believe most, if not all, hospital systems across Minnesota have had to do that. So we have bed capacity that we manage every single day. And that bed capacity is how many staff do we have in-house. So any time that we get staff calling in or needing to be quarantined, it impacts our schedules for the next 14-day cycle. And so all of those are, we cannot open a bed and put somebody in it unless we have safe levels of staffing. And that is whether it is a nurse exposure, whether it is a environmental services worker who we can't turn beds as fast because of the inability to get those rooms cleaned fast enough. So end to end across the health system, any of our staff that are involved in direct care being out has an impact. And so we do monitor those every single day, every single shift actually, to say how many staffed beds do we have, and we need to bring beds up and down based on staffing, which is a concern. We have talked to other hospital systems, and our experience is not unique. It is impacting other hospitals as well based on exposures of staff, as Kris mentioned.
Thank you.
Another question from the line of Kris Rogers with Winona Post. Your line is open.
Thank you. What direction is MDH giving local public health departments about whether to issue public alerts about establishments linked to outbreaks of 7 or more cases?
Kris, can you take that one?
Sure. What we do when we have a situation in which we've identified a cluster of cases associated with an establishment, we first reach out to our environmental health division, who usually does the restaurant inspection. So they will reach out to the establishment, talk to them about what we're seeing with our case data, work with them on what they can do to reduce transmission and ensure that they're following guidelines. So that's really our first step. And in many cases, or some cases, I maybe shouldn't say many, but that is actually a delegated activity that's handled by local public health. So we start with that kind of an intervention, and then once that has been done, we make the data public, but we don't require that local public health would announce that data or put out any sort of public messaging about it. Rather, we try to work with the facility one-on-one to help them address the issue.
And why doesn't the MDH encourage local public health to issue public alerts about that, or why isn't the MDH doing that itself? Wouldn't that help alert and quarantine exposed people?
Well, certainly we make the data available, and so we've provided that data to many news outlets. But we think that in addition to being aware of what may be happening at a particular establishment, that the broader issue of community exposure is a really important one. We're really past the point where we want people to think that everything is fine, except I attended an event at a certain establishment. There is transmission going on across the state and in all our communities, and so people need to be concerned about masking, physically distancing, and avoiding large groups regardless. So we'll make the data available, and if you're interested, we can certainly give you the line list of all those facilities.
Thank you.
Your next question comes from the line of Nora Hertel with St. Cloud Times. Your line is open.
I am wondering if you can talk a little bit about return time on testing. I am getting the impression that it's taking up to 5 or 6 days to get results back, and I wonder if you have a recommendation, if you're noticing any changes in the turnaround time for folks waiting for their results.
This is Commissioner. I'll start, and Kris, you can chime in if you have more quantitative data, or Jennifer, please chime in too if you have experience you'd like to share. In general, that is part of why we are doing everything we can to build more testing capacity right here in the state. Some of the longer turnaround times have been from the national laboratories when our health systems or long-term care or anybody who's got contracts with national labs to do their processing, that's where we've seen some of the longer turnaround times. So the saliva testing capability that we're building, the new laboratory here in Minnesota, all of that is meant to help us shorten those turnaround times, because it certainly is valuable for not only for patient care purposes but for controlling spread. Kris or Jennifer, anything to add?
Yeah, I'll just mention that overall the turnaround time is pretty good across the state, and as the Commissioner said, the longest turnaround has been for specimens that have been sent to national labs. We do know that occasionally there will be some delays for people, and certainly that gets their attention because they're waiting to know if they're infectious and need to isolate, or if they can, if they're negative and can possibly be back out into society. Not if they were exposed, however, but in other situations. So we know that people are eagerly waiting for that. In general, the turnaround time is good, but there are situations in which we've heard that people have had to wait, but it's never been a systemic issue. So in other words, it's more of a one-off situation rather than a systemic issue that we could work with the testing command center to help to address.
Okay, and then this might be kind of related. I know of some drive-through testing sites that have closed in the Alina system. I don't know if other systems have done the same, and then so that they could redirect their staff back to other clinics. Are you hearing that elsewhere? I mean, that kind of sounds like reducing the testing capacity, at least within that system.
We know that that health systems are making changes all the time in how they are able to offer testing. And we also recognize that with changes in the weather, that is going to make a difference in how they're able to do that. But keep in mind that the state has been increasing testing capacity across the state with the rollout of no barrier testing availability. So the hope is that as there's an ebb and flow within the health systems and as they're making adaptations to their testing, that we're also adding additional testing in other places and in other venues so that people continue to have access to testing. And I think that the high numbers of testing that we saw from yesterday suggest that at this point there is widespread testing available.
Okay, thank you. Oh, go ahead.
I was going to say, this is Jennifer. I was just going to add to that we're turning around tests and lab results typically in less than 1 day here at Hennepin Healthcare. But I will say one of our challenges is those staffing resources. So we're hiring for more labs. As we see more testing needed, as we see more positive cases, you see the compression across the system to hire more people because folks need to go home and sleep at night, and we need more capacity. So we are doing that to expand, to respond to the demand. But again, I can't emphasize enough that COVID-19 is a preventable disease. And if we all do our part to slow the spread and to wash hands and masks, our energy and attention doesn't need to be spent on all of that additional work in healthcare if it is indeed taking care of ourselves to begin with.
Okay, thank you.
Your next question comes from the line of Sue Croft with Mahnomen Pioneer. Your line is open.
Hello, thank you for taking my call. Can you hear me okay?
Yes, we can.
Okay. We've seen a recent spike in cases in our Mahnomen County area and on the reservation. And one of the reasons that was given to me by the emergency management director was family gatherings and COVID fatigue, people just deciding not to follow the guidelines anymore. Can you please address this idea of COVID fatigue? And obviously this is critical because I'd like to include some of your comments regarding that in my article. Thank you.
Sue, this is the commissioner. I'll start and ask Kris to chime in too. That is a really significant issue, and that's, as Kris said earlier, what we can see in the case investigations that the epidemiologists do is, as Kris said, this isn't just certain settings or one type of facility that's producing all this case growth. It is all of those activities and events happening all across the state, and increasingly we're seeing it in more private social gatherings rather than in the public spaces of our of stores and workplaces and places where people are in public. We tend to have done a better job, it seems, of paying attention to those prevention guidelines in public settings more so than we are in private settings, where somehow we seem to be feeling that we're safer if we're just around our family or our friends, and it's just not the case with this degree of community spread. So I think and that's true, by the way, not just in Minnesota. That is part of the story nationwide. I was just on a call yesterday with Health and Human Services leadership nationally, all of us state health directors and local health directors around the country, and that is the story over and over and over of family gatherings and different types of events that are happening with the backdrop of COVID fatigue, of people just being exhausted by this and somehow letting their guard down. And I'm just going to repeat the point I said earlier. things that we maybe did a month ago when there was much, much less lower levels of community spread and number of cases are riskier today than they were a month ago. And heading into the fall, we're going more indoors, and it's just going to be all the more important that we really pay attention to those gathering limits and social distancing and masking. Anything to add, Kris?
Well, I just pulled up the epidemiologic curve for Mahnomen County, and yes, so you're absolutely right. You guys have had an uptick in cases in the last week, and when I look at the type of cases that you have, about 20% of your cases are community contact with no known, explanation, and 35% are cases where there was a known contact. So, yes, you're seeing a lot of transmission in your community settings, and the fact that people may be feeling like, I'm done with this and I don't want to wear a mask and I'm just going to get together with these people, I'm just going to attend this event because I can't take it anymore, which is obviously a very understandable feeling at this point. That does contribute to spread, and you are seeing that in your community. So I think the message we want to continue to encourage people is that you do have the opportunity to make a difference in the numbers by the choices you make, and if you can hang with it a little bit longer, especially because of the high transmission that we're seeing, that can make a difference in what happens in the next week.
Okay, thank you. Any more?
No, that was good.
Operator, we have time for one more question.
Thank you. Your next question comes from the line of Mohammed Kali at Kali Radio 101.7 FM. Your line is open.
Oh, thank you for taking my question. Really, this is the first time our question raised. This is KALY 101.7 FM. This is the only voice radio they have East African, especially Somali community. So my question here is, how can we work MDH? And do you have someone Somali can update every day for what is coming out, so we can do our part? Because every day we said, help us, help you. So how can we connect it? Because we disconnected last couple months, and this is the first opportunity. I'm sending our message for us KALY radio. This is the only FM radio 24/7. They rely on our community, and especially East African community is oral society. So always when we tell them today everything is going up, the test is going there, you have to understand what the quarantine is. So who we should work with? Did you have some East African community working MDH, so we can make sure we can ask every day the question? And I think we need long hours to save this life. This is a very tough time we all going through, but we really want to do our part. But who we should work with?
Well, thank you for that. And it is so important, as you said, that we reach specific communities through their trusted resources. So we appreciate you being on the line. We can follow up with you offline to give you the contact information for the folks in our agency that do work very specifically with the East African and Somali community. So we will get your contact information and get you in touch with those right staff, unless, Kris, you have anything else you'd want to say at this point.
No, I just want to thank you. I hope we can get some people to work with us closely, because this is a saving life, especially our community, non-speaking English. They always rely on, they trust us when we tell them, look, the corona is going up. Make sure you guys test it. Make sure you stay at your home. Make sure when you go on shopping, cover your 6 feet. So this is something we need long hours, really, to save people's lives.
Yep, thank you. And I'll just add that we have a number of Somali staff on our staff who are helping us with our response. And so, as the commissioner said, we will be able to connect you not only with resources you can use for your community, but also we'll be able to connect you with staff that will be able to provide messages in Somali for the community. So we can do that both ways, and we'll be happy to do that.
Thank you.
That is all the time we have for this afternoon. We do invite reporters with additional questions to reach out to the communications office this afternoon. Have a good day, and we will be back with you again on Monday.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.